Pediatric MS only makes up about 5% of all cases of multiple sclerosis. Now, granted, you're talking to a pediatric neurologist, so I think all MS probably starts in the pediatric years, but we're actually only catching it later on. And our multiple sclerosis in kids looks a lot different. So before the age of 12, so before puberty for most patients, it tends to be a 1-to-1 ratio of male to female. The lesions tend to be larger. There's a much higher rate of having acute disseminated encephalomyelitis as your initial presentation. And then after the teen years kind of start up and puberty begins, we see more of that classic 3-to-1 ratio for females to males. And then the disease tends to kind of proceed on a more typical relapsing remitting type of course. We do use different criteria. So the International Pediatric Multiple Sclerosis Study Group criteria put out a manuscript in 2013, which was first authored by Lauren Krupp. And that's what we use for the diagnosis of pediatric MS. It is very similar to McDonald's criteria, with the exception that we also include acute disseminated encephalomyelitis or an encephalopathy-based neurologic attack as a potential for a first attack. But otherwise, we see that there's a pretty high concordance rate with the McDonald's criteria as well. Another important differentiator is that individuals who have pediatric onset multiple sclerosis are almost twice as likely to relapse. And so while the general consensus in adult multiple sclerosis has now had a paradigm shift to early and aggressive therapy, that's particularly important in pediatric MS because we see almost double the relapse rate. And that's been very consistent over time as well.